Maria von Kerkhoff, our technical lead for COVID-19. We have also Dr. Bente Mikkelsen, Director of Noncommunicable Diseases. Joining us online will be Dr.
And as Dr. Tedros said, we have had several surveys which show that we have major disruptions in the case of non-communicable diseases, cardiovascular diseases, cancer, diabetes, and respiratory diseases. So far we have comorbidity studies from single countries, and we are working on this also at a global level. So of course it will be very important to trace what you're actually saying, because we really need to know if this will again dwindle the achievement of the SDG 3.4, namely to reduce the mortality from non-communicable diseases. So we don't know this yet, but from studies we know, and the good thing is that the majority of countries have actually now started to register comorbidities in their hospitals. So we know that, for example, in Mexico, diabetes were the most frequent comorbidity in the registered deaths for COVID. And we see other figures like in Italy, among those dying in hospitals, we see 67% of people living with hypertension and 31% living with diabetes. So this is, of course, very important both for the current situation, but also to understand the picture and be able to close these gaps with the guidance that WHO can give. Thank you.
Dr. Bruce?
No, Agnes, you raised a really important point about this excess mortality data. And as Maria laid out, many countries do track excess mortality, not all countries, so we don't have data from all over the world. And as Maria said, it's actually tracked differently in some countries, so we don't have exactly comparable data. But what we do know very, very clearly is that there has been more mortality during this period than the numbers from COVID-19 alone tell us. And that's extremely important. Some of that excess mortality is probably COVID disease that was not recognized or reported, but then it's also telling us that this incredible impact on the health system that Gabrielle asked about earlier is having a real cost in terms of human lives. And this all emphasizes the importance of the measures that the Director General has just emphasized day after day after day, because there's a real cost in human lives that go beyond the numbers that we're seeing in the COVID numbers alone.
Thank you all for these answers. We will go now to India to ask Aziz Ahmed from Hello Mumbai. Aziz, can you hear me? Please unmute yourself and ask your question. Aziz? I was told he's no longer online. If not, we will go to